The public health emergency is extended through January 2023, and United Health Group pulls out of a very crucial market in the state of California. Buckle up, everyone. You've just plugged in to your very first RCM Roundup. Let's go. Hey everyone, Tiffany Robinson here from Beyond RCM Revenue Cycle Management here in the beautiful state of New York. And thank you so much for tuning in for our very first numero uno RCM Roundup. Now you might be asking yourself, what is this RCM Roundup that you speak of? Well, I'm going to tell you. The RCM Roundup is meant to be a bi-weekly series where we will come to you and discuss evolving topics trending in the healthcare space. These topics will be very specific towards medical billing and coding and the overall revenue cycle management process. So if you have not done so already, please do not forget to like, subscribe, and hit the notification bell so that every time an RCM Roundup comes out, you're the first one to know. The first topic I want to talk about today has to do with the Public Health Emergency Declaration. The Biden administration announced last week that it intends to extend the PHE through January of 2023. Now, what that means for medical practices such as organizations here in New York State and many other states throughout the country is that telemedicine will continue to be an option to provide healthcare services to the patient population. If you're not familiar, prior to the COVID pandemic, telemedicine was only reserved for medical practices that were in rural areas where it was difficult for patients to access care. Once COVID took hold in 2020, CMS approved telemedicine in and throughout the United States of America. And since then, many practices have adjusted their workflows to work in a hybrid model where they have patients coming in and they also have televisit services. So with the PHE being extended through January 2023, this means that telemedicine will continue to be a covered benefit. Obviously, you'll still need to continue to abide by your payer guidelines and make sure that you're reporting your bills with the proper place of service and modifier and CPT coding. One thing that I do want to recommend, though, is I think it's very beneficial for practices to start having discussions about what their workflows are going to look like once the public health declaration ends. We are hearing some buzzings from CMS that they intend to leave telemedicine in place post the COVID pandemic. However, we don't want to put all of our eggs in that basket. So I think it's important for practices to start talking about what life is going to look like in the event telemedicine is removed altogether once the public health declaration ends. As always, we will continue to monitor what's going on as it relates to the PHE, and as soon as anything changes, we're going to bring it to our channel. The second topic I want to talk about today has to deal with United Health Group. We're getting a lot of feedback from our partners in the state of California, and we've even seen correspondence ourselves from United Health Group advising that they intend to pull out of San Diego County for their United Healthcare Community Plan as of January 2023. The community plan is typically offered to patient populations who are Medicaid and Medicare eligible. Many providers who are currently participating with the community plan in San Diego receive notification either by mail or fax advising that as of January 2023, community plan will no longer be offered in San Diego County. Now, if you know anything about United Healthcare, you know that they are the largest payer organization, commercial payer organization here in the United States of America. And we know that California is one of the largest states here in the United States of America. So United Healthcare Community Plan pulling out of San Diego County is a big deal. So if you are a provider that participates with this plan in San Diego County, I encourage you to please have your billing staff reach out to the plan and confirm that they are in fact opting out of this area as of next year. And if you're a member with community plan in San Diego County, It's very important that you reach out to your local Medi-Cal office, that is the California Medicaid program, and enroll in a new managed care plan as of January of 2023. Now, we have reached out to United Health Group to see if other counties are being affected by this change, such as Los Angeles and Santa Clara County, and we have not gotten confirmation at this point. So far, the notifications that we've read only pertain to San Diego County. However, we will continue to monitor this as well and update you as soon as we hear anything. Now, finally, I want to leave my best practice pro tip dedicated to my newbies. And I just want to say, if there are any questions or topics that you would like us to discuss in future RCM roundups, please feel free to leave us a comment in this video. We will review them and we will vet your questions, and I'll be more than happy to discuss them in future videos. And I just want to give a quick shout out to one of our viewers who has been tuned in to our channel from day one when we launched our series, Medical Billing and Coding for Newbies. And if you haven't checked out that series and you're a new MBC, it is a 4-part series. There's so much great information in there. I encourage you to check it out. But I want to just give a quick shout out to Vicky P. Vicky has been tuned in to the channel since we launched our summer series. She always supports all of our videos and leaves amazing comments and encouraging comments. And it's comments like yours, Vicky P, that make me continue putting out these type of videos, which I'm doing this video after a 12-hour workday on a Monday night. Because of people like you, Vicky. Thank you, Vicky. My pro tip of this week goes out to my newbies, and it relates to ICD-10. So every year on October 1st, ICD-10 updates its coding. Now, ICD-10 is published by the World Health Organization, and these codes, once they are revised or deleted, they take effect immediately on October 1st. So for example, last year, we had a very common code that we were using for many years, R05 for a cough. And as of October 1st, ICD-10 expanded those codes, and then we had to choose either acute cough, chronic cough, unexplained cough, cough, cough. But those changes took effect as of October 1st last year. So what happened was we had claims that were being paid on September 30th with R05, but then when we billed R05 on October 1st, the code was revised, and we had to then use one of the new revised expanded codes. So it's very important as medical billers and coders that around September, you start checking your blogs and accrediting agencies and getting a feel for what codes the World Health Organization intends to update in the next round of ICD-10 updates. And familiarize yourself. See if any of those codes pertain to the specialty that you work in, and make sure that you update those codes and that you begin using them as of October 1st. It's very important that any codes that are revised for the coming year or for the coming reporting period, which starts on October 1st, that you don't start using those codes until October 1st. If you try to use them on September 30th, your codes are going to be denied. Likewise, if you try to use a code that has been deactivated or revised or expanded as of October 1st, that code will also be denied, and you will be told that the code is invalid by your local clearinghouse. So put in your head that every September, you're going to start doing your due diligence to see what are the ICD-10 codes that the World Health Organization are looking to update, and make sure that you set your systems up to accommodate those changes, especially if the codes pertain to a specialty that you work in. And that's it, guys. You've just tuned in. We've just gotten through. I am so excited. I'm sleepy. I'm excited. I'm so many things. But thank you so much for checking out our very first RCM Roundup. If you like what you saw in this video, do not forget to like, subscribe, and hit the notification bell. We will be putting out content at least twice a month as it relates to evolving topics. I'm so excited to share all of the new information that we get. We get our information through webinars, through press releases, through faxes, we get through colleagues, we get it through forums, through so many different ways. And it's very important that as we get this information that we share it with one another, because the more we know, the better we become as healthcare professionals. So thank you so much for joining me. My name is Tiffany Robinson. I have the pleasure and privilege of being the Revenue Cycle Management Director of Beyond RCM, and I will see you soon. Bye.